Hi, I'm John Lenihan, a robotic surgeon from Tacoma, Washington, now working with Mimic Simulation. And I'm talking today with Mireille Truong. Who do you have with you, Mireille?
Hi, well, this is Nico. He's 2 months old now. Yeah,
Ah,
yeah. So he's
what a
he's
joy.
learning the ways of robotics as well.
Well, for many of you probably know Mireille is a robotic surgeon who um, trained in the East Coast and worked in Virginia and now has moved to the West Coast at Cedar Sinai, where you're head of the robotics training program there, Mireille.
Yeah, and then I also am the co-director at the simulation center as well. So I do a lot of surgical simulation training as well. So
Great.
um, yeah.
Great. Well, the point of our discussion today is I know Mireille has been away from the robot for a while for obvious reasons and is getting ready to come back. And all of this is on top of COVID. So a lot of her trainees and other surgeons have been away from the robot too. So we'd like to ask you your feelings as a FMIGS trained surgeon and a busy robotic surgeon stepping away for several months, like you have. What's it like for you to retrain? How do you retrain? And what about your residents and fellow surgeons? What are your thoughts on that?
Yeah, so for myself, yeah, I mean, on top of COVID with all of our, surgical cancellations for, some of us 30 to 40 days, and then me on maternity leave now for a couple months. There's always that thought about how much, you know, skills kind of degradation, even though we're experts.
Right.
We still, it's just like being an athlete, right? Or,
Sure.
playing sport is, when you're away for a little bit, I mean, regardless how good, how much of an expert you are, you still need some practice and something to maintain your skills. And I think about that a lot, even for myself and what it's going to be like to get back into the OR, get your kind of your mind back in the game, right? Because you've been
Right.
away. And I think it's the same as like an athlete where you have to plan out your gameplay, your skills practice. So I think it's similar to that. Um, and so for me, it's both for robotics. I mean, I'm really grateful that I've been able to have access to a simulator so I can work on just practicing my skills. And yeah, it might not be surgery, but it definitely gets my psychomotor skills kind of going again, kind of re-oiling the machine, right? So
Right.
so I've been working on some robotic simulator exercises for sure.
So in the past, if you wanted to practice, you would have to go to a simulation center or to the OR where there's a robot simulator. So you've had the ability to have a simulator, a portable simulator in your home. How's that worked out?
Yeah, it's really nice. I mean, being, with even with COVID and, being on maternity leave and not really being able to go to the hospital, really having this portable Flex VR simulator has been super helpful. And I love it. I love that it's, I can just put it on my dining table and it doesn't take up that much space. And it's super easy to set up. Yeah. So, and when this guy's sleeping, I actually can do some simulation too. A little tip for moms out there. It'll really help you with your clutching skills. I do some
Ah,
clutching exercises, and you're trying not to move and just your hands. It's great.
good
um,
tip. How have your residents and trainees been doing during this period? What have they been up to?
we're very lucky, and I know not every program's like this. Is to we're lucky to have simulators at our institution outside of the OR. So they have access to that. And so they usually are required to go on the simulator before they even are able to sit at the console.
Normally.
Yeah, exactly. And they have specific curriculums, different levels.
Yep.
Um, so we have, like a orientation one, so they are familiar with the system. Ooh. And then we also have a kind of more one that we want residents to do throughout their training. And we have a more advanced one so that if those residents like who are interested in going into fellowship or really want to integrate robotics as part of their practice when they graduate. So we also have that kind of, it's more optional for them, but the other one's more focused on how to use how to use the robot, how to be safe, how to be efficient in the OR, but not necessarily, you know, super advanced skills, but just safety and efficiency.
Yeah. So we had talked before about if you have remote training like that outside the OR, how do you keep track of the residents? And you, I think, it expressed at the time that it would be really nice rather than having to be there and watching them if you could do that remotely somehow. So I'll let you know that we've discussed that, and that's really a good idea, and that's something we think we're going to move forward in the future, is setting up some kind of remote training capability for simulation.
Yeah, I mean, right now already with the cloud that you have, it's actually super helpful. I mean, I used it at my prior institution, the cloud, to kind of check on my trainees' progress, and they can even
Right.
look it up themselves. I really like the future where you can upload a video and you can provide feedback. I think that's really nice. I mean, obviously it's in the kind of in its infancy, and I think there's definitely lots of potential there, but it's definitely helpful as well. And you can design your own curriculums. And I realize now, after doing lots of trainings, is that everybody learns at a different pace and needs
Right.
different skills training. So it's easy to like customize or individualize certain exercises, and it's not about how long someone really spends on the simulator, but it's more just like how long it takes them to get to proficiency, and it's everybody's a little bit different in terms of how much time it takes them.
We call that the portal. Our cloud is the mimic portal. Being able to see where the residents stack in their scores and who's struggling and who's getting it fast, really helps you as a program director. And then being able to tailor the curriculum as needed. So I mean, you're definitely at the forefront of that kind of experience, I think.
Yeah, and we were getting, monthly reports on different metrics that we wanted to
Yeah.
follow, and it was just kind of interesting to see, between the different specialties, like which residents or which program was using it the most, or kind of, it's a little competition.
Yeah.
Everybody likes competition, right? But it was good to see that as well.
Well, residents love competition.
Yeah,
We're all the best, right?
yeah, I think most of us do in medicine.
Good. Well, thank you for spending some time and sharing with us today. I think we've covered a lot of topics, and I can see you're really going to have your hands full in the next 20 years. So,
Yeah. And well, this guy's got a little taste of simulation too,
uh,
right?
well, that's something good that's come out of all this COVID nonsense. This is, you got something good to take away, and hopefully you both stay very healthy, especially as you get back.
Yeah, no, I'm very grateful I have this simulator to keep up the skills and to practice before I go back.
All
Yeah,
right.
for sure.
Well, thank you for sharing, Mireille, and we'll hope to see you soon at a live meeting.
Yeah, look forward to it for sure.